Hey, do you know if your doctor will prescribe early treatment for COVID? I wanted to talk to you about this because we really need to have our ducks in a row and know where our doctor stands. We need to make sure we have a doctor and make sure that we know where he stands, because I told you last week, my husband did have COVID and he did get really sick, and I feel like having early treatment made a big difference for him, and he's a pretty healthy guy. So for all the rest of us, and as the variants can get worse, possibly is what I'm hearing, that is what is happening in other parts of the world, and so we need to be prepared. We need to have good doctors that we can trust, that we know are really thinking and taking the best care of their patients. So having a conversation. So I went to a new doctor that I spoke to a area pharmacist, someone that I knew, and told her that I just wanted to make sure that we had somebody local. Did she know someone local who was prescribing early treatment medications like ivermectin? And she said yes, and she had seen this one and he was great, and so I made an appointment and I asked him about the early treatment, and he really shared a lot with me about his experience, because he is on staff at 2 hospitals in this state of Texas. I'm in Texas, and so there is one hospital that is very guarded in their treatment, and they don't allow ivermectin on the hospital formulary, so it's not used. But at the other hospital where he is on staff in their ER, he can prescribe at will what he believes that the patients need, and they do well with the treatment that he gives them, including ivermectin and hydrochloroquine, and they do use the monoclonal antibodies, whereas at the hospital that's closer to me, they are more guarded about who they will allow to get the monoclonal antibodies. So he himself is applying to be a provider of that treatment, so that someone can come just to him instead of having to go through the hospital system for that treatment. So it was a great conversation. I really appreciated that he took the time. He really just talked for several minutes. I know how busy doctors are and how they have their appointments back to back, and I appreciated that he took the time to really share his philosophy and his experience, that he wasn't a believer in ivermectin right away, and he saw the evidence and started to use it and saw how it was effective, and using using medicine the way doctors would normally practice, and that's not happening. And he shared with me how he is seeing that that's not really happening the way it always had in the past. That helped me to feel not so crazy too, because that was kind of how I felt things had been going, that things were just so different from what I had known. If you don't know me and my background, I am a registered nurse, and haven't been working as a nurse for the last couple of years, but I have been a nurse since '93. So things are very different since this pandemic has started, since anything I have ever seen, and it is it's worrisome to see. And so I feel better knowing that he is someone I can trust, and he will see my family even though they haven't had their first appointment. He will take care of them if something, if they get sick, and he wants that early treatment. He isn't going to make us wait to see how we do and see if we get worse. He'll give the early treatment, he'll give the prophylaxis, and so I just want to encourage you to find someone in your area that believes in that. And I also want to share that even if you've had the vaccine, if you have not, early treatment, because you know that you can get you can still get COVID, it can still get severe, maybe less severe than it would have, but early treatment is helpful for anyone, and it can be helpful for preventing long haulers, which is what I'm really hopeful for and feel more confident about with my husband's situation, that he is going to avoid long haulers. So far so good, except he is still not having his smell and taste, but it is slightly there. He can taste and smell some stronger smells and tastes, but it's mostly smells, not so much taste. Taste is sweet and salty. But anyway, that's off the topic. Make sure to take care of yourself, get a good night's sleep, have a consistent bedtime, eat lots of fruits and vegetables, cut down on or cut out flour and sugar, cut out anything that causes inflammation, and make sure you're getting lots of antioxidants, and exercise. Be active. These things will help you in this time. These are important, and I think they have really been forgotten. So don't forget, and I will see you next time. Bye for now.